Welcome to Weekend Night Live, hosted by Samuel Jacobs Abbey, where we play music, talk shows, and interviews on Be Inspired Podcast Network. Stay tuned and keep your dial on www.beinspiredpodcast.com. Don't forget to stay connected, be inspired, be unique, and be different.
Hello, my name is Conn Green, and I would love to share some products that I found that are very beneficial to not only my body, but I'm sure that they would really help your body. I found out that a lot of us are impacted and we need to be detoxed, and I found some wonderful products that will safely detox you and help you to eliminate the waste and feel good about yourself. We also have products that will help grow your hair and give your skin more vibrant radiance and suppleness and help with wrinkles. I also have products that will help with joint pain as well as help you to lose weight. These products are all natural, therefore you don't have to worry about putting something in your body that's going to add problems to the problems that you may already be facing. So if you're interested, please give me a call at 706-426-1471, or you can email me at preciousjewel492@gmail.com. Thank you and have a blessed day.
Wamaya, Wamaya, don't you? 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 Wamaya, Wamaya, don't you?
Okay. Hi, my name is Samuel Jacob Sabi, and I'm the host of Be Inspired with the Weekend Night Live with Samuel Jacob Sabi on Be Inspired Podcast Network. I just want to invite you and your family to tune in every Saturday at 3:30 p.m. Eastern Time and also at 7 p.m. GMT for those across the Atlantic Ocean to tune in to listen to inspiring voices, to listen to our interviews, individuals who have excelled in different forms of life. We bring them so they will be able to share their stories, and we know that their stories will have an effect on you. On Being Inspired Podcast Network, our mission and our goal is to empower people from around the world who have attained a certain height and sharing their stories to make a social change implication. Social change is very important, and it is important that individuals, families, society, and leadership spend time to acquire knowledge and skills to help formulate policies and ideas to help shape their communities. That is the more reason why I want to invite you again to tune in every Saturday at 3:30 p.m. Eastern Time and also at 7:30 GMT on Be Inspired Podcast Network. You can catch us up on www.Be-Inspired Podcast Network, or you can also join us on our Facebook at Be Inspired Podcast Network, and we can have fun. Once again, tune in and have fun. God bless you.
All right, ladies and gentlemen, once again, we want to welcome you to Be Inspired Podcast Network, the managers of Be Inspired Radio, and we are very excited that each and every one of you have made some time today for us to discuss a social change program. As we have always done on this show, we have spent time to discuss factors and situations by which we are able to bring a social change to our community. Today, we are also very privileged that because we are in the month of October, which is generally known as the month of pink, because it is a month that is put aside by the international community and the health community to create awareness with regards to cancer, particularly breast cancer. And so today we will spend some time to discuss the issue of breast cancer, and our case study will primarily focus in Ghana, and we are going to look at the subject or the title, changing the status quo in cancer care in Ghana. We are so privileged that for such an important topic, I say important because this topic it's of great importance to a lot of people, particularly women, but of course men are also affected by this situation. Last year around this time, those of you who are followers of Be Inspired Radio, you will recall that we brought oncology nurse in the person of Susan Kondua, also a clinical faculty at George Washington University last year, to talk in details about this subject. But today, a year on, we are very privileged that Gloria Yankson, also an oncologist nurse, will be our guest to help us decode and to see how we can change the status quo in cancer care, particularly in Ghana. For those of you who are joining us for the first time from around the world, let me take this opportunity to thank all of you for your participation in this program. I am so happy to see about 19,515 people from all over the world listening to this show, and I could not be more grateful to your loyalty to this program. So Be Inspired Radio is it's an organization with the status of a non-profit organization registered in the Commonwealth of Virginia, and the purpose or the aim of this institution is to bring social change implication to people around the world. And we do so by, one, identifying individuals who are doing so well in their place, and then we bring them to a place where we are able to use their expertise to promote social change implication. So today we are very privileged that Gloria is joining us even as we discuss the issue of cancer. And so Gloria Yankson is a registered cancer nurse by profession, a cancer advocate by passion, the founder of Partnership in Cancer Care Initiative, PCCI, and project director of Cancer Connect Ghana by default. I firmly believe that she has been called to bring hope to the downhearted. Gloria is married with 3 strong soldiers, all hailed from Kwewu in the eastern region of Ghana. She holds a Bachelor of Science degree in nursing from Coventry University in the United Kingdom. She is a trained and certified chemotherapy and oncology nurse from Buckinghamshire and Chiltern University in the UK. And she worked as a specialist for about 16 years, inclusive of her training both in Ghana and in the UK. She holds a postgraduate certificate in diabetes care and trained in patient communication and end-of-life care. Gloria started her nursing career in England at the Mount Vernon Cancer Center, where she worked as a staff grade nurse and rose to the position of a team lead. She relocated to Ghana in 2008 and joined the National Cancer for Radiotherapy and Nuclear Medicine at the Kolebu Teaching Hospital. where she served for almost 4 years. This move gave her first-hand experience of the healthcare system in Ghana and the opportunity to support patients and help them in little ways to navigate the healthcare system. She later moved to Sweden, Ghana Medical Center, the first private oncology center in Ghana, and became one of the pioneers of the center, establishing the chemotherapy suite and heading the nursing team. She made strides in cancer care, having the opportunity to be part of the decision-making board. She worked at SGMC for 5 years before finally decided to start PCCI and dedicated her time fully to patient support and navigation. As part of her role in cancer care treatment and training, Gloria in 2015 was privileged to be part of the curriculum development team for the current fellowship program for the Ghana College of Nurses and Midwives. Gloria is a highly qualified and experienced nurse in cancer care with the best of the best in the world, having trained and worked both in England and in Europe and in Africa. She's passionate about cancer care and shares the belief that hope and dignity are not commodities reserved to the global elite. They are fundamental right deserved by all. And so, folks from around the world, you could see that our guest very experienced. So let me welcome to the studios of Be Inspired Podcast Network in the city of Woodbridge in the Commonwealth of Virginia, Gloria Yankson. Gloria, welcome to Be Inspired.
Wow, thank you. Thank you very much. Thank you so much. I'm actually really honored to be on the program today. And I'll say good afternoon, right, to all the listeners around the world. And thank you for connecting with us.
Wow, thank you so much. Thank you so much for this background. We are very privileged to have you. I know I read a tall profile of you. I am sure there are a lot of things
very tall.
I'm sure there are a lot of things that we couldn't include in it. I'm sure, but we have a tradition here at our studio to go back to the guest and like in a minute or two, just give us your own introduction in your own way, in your own style, so that a few of the things that we may have skipped, we could capture them. This is important to us because you are speaking to well over 19,000 people, and it's important they know all this background. You never know. Thank you so much.
Mm. Thank you. Thank you so much. I would say, as you said, that was a tall introduction. I am actually, as I call myself, Gloria, passionate with what I do. Some years back, by the grace of God, I was actually directed to my calling, and I found it actually in caring for people and supporting people. So, as I said, young woman, let me put it that way, married with 3 kids, have a very supportive husband, trained in nursing some years back in England, and completed that. I think when I did complete my nursing degree, my concern was, what do I do next in terms of where would I want to specialize in? And also in terms of, would I want to stay in England or would I want to come to Ghana? So those were the 2 things that was in my mind. But I would say, God in His own wisdom actually ushered me into the right specialty, which was in cancer. Now, when I made that choice, everybody around me that knew me was actually shocked. They were wondering why I would actually go into a specialty where you end up seeing a lot of people dying. And for them, they didn't think that was anything to be inspired about. But I did. And I have never, ever, ever regretted making that decision. And again, I believe it was orchestrated by God as well. So I stayed in England for a while. I did a bit more postgraduate studies in oncology, in palliative care, and then in chemotherapy administration as well. And then, as God would have it, when the time was right, I returned to Ghana. Prior to actually coming home for good, I did a lot of voluntary work when I came down on holiday, just to try and understand how Ghana works, because I didn't get the opportunity when I was in Ghana to even go into hospital. Once again, nursing wasn't what I was looking at in secondary school. So going to England, having a scholarship, and then going to do what I was passionate about was just good, basically. So came down eventually because I had actually gathered a lot of, I'd say, experience with regards to how patients care was like in Ghana. And I didn't really want that because I realized that back in England, most patients were empowered. They took over their health care together with the healthcare professionals. But back home, what I found was they were at the mercy of the healthcare professionals, which was very unfortunate because I could recognize that there was a lot that they could do. It could reduce a lot of the burden that we have here, but already we don't have a lot of expertise around. And also, it would actually make the patients a bit more compliant, so they do understand what is wrong with them. They know what to do at any point in time, and therefore they were actually going to be compliant to the treatment and all. So after some time doing voluntary work each time I came, again, the right time came where I decided to come back home. Then my husband was back home already anyway, so it was very easy to reintegrate back into society. So I stayed in England for almost 11 years with training and then eventually came back home. And when I did, I had the opportunity to work, as you have said, at a public hospital, which is at Kolebu. So most Ghanaians will know about that. It's one of the biggest public hospitals in Ghana, within the cancer unit. And then again, as God would have it, a few years down the line, I had an opportunity to work in a private setting, and that was actually to help them set up a cancer unit. So we started basically from nothing to when I left, staying there for 5 years. And I had, because of experiences I had at any point in time, when I came to Ghana, there was a quest to push how things were done in Ghana, especially in the healthcare system, and to push us beyond our boundaries. It hasn't been easy because people are really used to what they know already. And therefore, it's very, very, very tough and challenging to try and change people's mindsets to say, this is what it should be, especially now that we're in the 21st century. I thought I wasn't making as much impact in the private sector as I would, because again, because it's a private sector, you will get normally those people who can afford it. And so for those who were not able to afford, and for those who needed that support a lot more, unfortunately, I didn't feel that I was making that impact in them because I didn't meet them like I did in the public setting. So I decided to bow to frontline nursing and to do this, which is to support those affected by cancer throughout Ghana and beyond. And I have, again, never regretted doing this. I just love it. So 2 years ago, I did that. It was a tough decision for my family, I would say, because it meant a lot of things. It meant, especially for my husband and I, it meant that two people were bringing an income in, but from the time I decided to leave work, one person was just bringing an income in. And if you know a bit about Ghana, the cost of living is very, very high, even though we're in a developing country. And I have 3 boys as well, and other extended family who also depend on me. So that was a tough decision. Again, it's a decision that I made easily because of who was behind it, which I would say it was God who actually orchestrated this. So as tough as it was, it has been a beautiful journey. A journey of actually, I would say, even though you don't have as you used to, you still appreciate life. And my patients actually give me that opportunity each time. They actually make me know what life is worth. And you would know that if you're sick, even if it's malaria, which you're very, very, very unwell with. So I see life differently now as than I did before. So I'll say that has been a bit of my journey. So a year and a half into partnership in cancer care initiative has has been beautiful. It's been challenging. If you know much about Ghana, we're not as um, um, good in supporting these initiatives a lot more. So finances has been always the top of our list, trying to support others and go through their treatment. But there are other things we do as well. So we normally would educate the public as well as those who have been diagnosed or affected. And we take them through a lot of information and counseling. Then we do the navigation system as well because most people come from different regions. They may never have actually come to the big cities before where they would get their treatment or where treatment is available. So they come into a big space where they are very lost. So we're there to hold their hand, to put them through the system. So we book in for them, we show them where to go next. So sometimes you just enter into the doctor's surgery and they say, you do this, that, and that. Our services here is also very, very fragmented. So you wouldn't get everything as a one-stop shop. And it's not also easy for a doctor to point out where you should go. The patient gets really confused, and in the end, they get lost in the net. So they either default treatment, they're so confused, they don't know what to do, and then they just give up. So we're actually there to hold their hand. And then we have another aspect, which is the psychosocial support and then financial support as well, because that is very, very important to actually have a successful treatment. But cancer treatment is very expensive. And I'll say that is a bit about me and my journey through cancer care.
Wow, wow. This is indeed a tall journey, and I am sure if we have all the time, you will definitely have gone on and on and on and on. And
Yeah, sure, sure,
personally, I
sure.
admire people who are able to identify their area of a specialty and give their best without a measure, and that's exactly what you are doing. We thank you
Thank
so
you.
much for the choices that you've made, especially to manage the lives of people and help people get hope again. Because the fact of the matter is that, irrespective of how one may want to take a look at it, the fact that the word cancer is associated with you, you'll be shaking from your head to your toe. But people like you bringing hope and letting others come to that realization that the fact that you've been diagnosed of cancer does not mean there is no hope. It's a good thing to do. So as we go forward with our conversation, I know we are looking at changing the status quo, particularly in health, in cancer care in Ghana. Now, give us an overview of the cancer care in Ghana. What has been the perception, the stigmatization, and the people's view on the subject itself before we dive into changing the status quo?
Mm. Yeah, thank you for this again. An overview of cancer care, when you're even thinking of statistics, shall I say, up until a few months ago was basically non-existent. And we're still struggling with that. But we're seeing more and more of cancer cases in Ghana. And I would say it's increasing because now people are reporting it a bit more unlike before. But cancer has been with us for a very, very long time. It's just that most times those in the rural areas, they don't actually know what it is, and therefore they attribute it to other things. as well as the fact that cancer in general is actually attributed to um, evil spirits, and it's actually seen very spiritual, instead of being a physical disease that has to be tackled that way. So we have a lot of people who are being affected by cancer. Now, compared to, I'd say, in the United States, the cancer prevalence in Ghana is not as high as that of the United States, but the mortality is higher. So you'd have patients coming very late because they're unaware, and that is one of the reasons why there's that mortality. That mortality is very high, coming because there are those myths and stigmatization and misconceptions and the cultural attitudes towards healthcare and towards cancer itself. And another thing we'd want to consider is within our own Ghanaian language, we do not actually have a better understanding of what cancer is. We don't even have one word for it that we could all identify with. So there are different things people are saying. So depending on the community that you find yourself in, you'll be wondering what at all it is you're talking about. So that is one of the biggest challenges as well. But we're seeing for breast cancer, we've seen numbers like 60,000 or so in a year. In 2012, we thought it was about 12,000 up to 15,000. And now we're saying it's 16,000. And this is just reported cases. And so there are a lot more that are unreported. And again, we have 80% of the people dying from cancer because they're coming very late. There's lack of awareness. Treatment is very expensive. We don't have a lot of infrastructure here in Ghana, as well as the specialists. The ratio is just ridiculous. It's just ridiculous. And again, as well, because it's attributed to spiritual issues and the culture surrounding it, you have people coming from the beginning that they will end up defaulting. So we have all of this as a backdrop to what we're trying to do to change things. And as a nation as well, cancer care is not actually a priority. So if you know a lot more about Africa and Ghana, you would know that what was was very important to us some years back and still is, even though trends are changing a little bit, were those communicable diseases, because they were actually killing people faster than they living longer to be able to even get cancer. Because cancer is a disease of aging as well. So those are some of the things you have to contend with. And if you also look at breast cancer, in England, I always say, I was actually treating most patients that were old, menopausal women when it comes to breast cancer. And even for all other cancers, over the age of 50 mostly, if we're not looking at childhood cancers. So, but then in Ghana, things are so different, especially breast cancer patients. The highest proportions are being diagnosed, or the age group is from the age of 40 to 49. And those as young as 20 get it. And I was actually shocked to my bones the first time I met a 15-year-old diagnosed with breast cancer. And I have a lot more of those 20, 25, 30 women in their prime, childbearing age, being affected by this. So the trend is a bit different from how I used to know it to be. So the burden now increases. And then again, we don't have cancer as a national priority. Yes, I am hoping that things will change. So there isn't a lot of budget going into it, to be honest. So it's a very, I'll say, it can be quite challenging when it comes to trying to get off the ground and then do something good for the patients. I'll say that would be just a brief overview of cancer in Ghana. Oh, and I'll also add that the whole of Ghana, we have 29 million people now, and we only have 2 public centers. 2.
Wow.
One in the middle belt, and then the other in the capital city that treats cancer. So just number of
Wow,
So you can imagine what patients
that's
are going
interesting. You know, when you said that, it reminds me so much when I was assigned as a United Nations person to Liberia, and
through.
during the war, you know, they only had one medical center, the Robertsfield Medical
Wow.
Center, and so the whole country had one medical center, and your guess is as good as mine. Uh, it's
Mm.
such a challenge that Ghana, which is considered as a gateway to Africa, will only have two or three cancer centers to address such issues. But what caught my attention was the alarming rate at which younger folks are rather being diagnosed of breast cancer as compared to uh, older folks in the developed countries. Now, a question
Mm.
came in, and I know we have not gotten to the question time yet, but because it falls in line with the what you just said, let me ask. So this question is actually coming from Robert in Sydney, Australia. And
Mm.
Robert said, Gloria, thank you so much for your work. When Samuel posted your flyer, I went to check you out, and wow, you've been doing some good work in Ghana. Congratulations.
Wow.
I am a
Thank
physician
you.
here, I'm a surgeon here in Australia, and I'm a continuous listener of Weekend Night Live with Samuel. Uh, One of the things that you said that caught my attention immediately was the fact that more younger people are being diagnosed of breast cancer in Ghana. Now, has there been any research study to to prove why this is happening?
Thank you. Thank you so much. That I would would have added. Unfortunately, not. So this is one of the things that I advocate for a lot more. We live in a country where research is non-existent. So to put it in a better perspective, when somebody is diagnosed with a disease, we are unable to look within us to find out or to even ascertain what the cause is. So we're stuck with information from the developed world, I would put it this way. And I did say that before I came to Ghana, I was treating really older people. When I came to Ghana as well, all the literature that we had in Ghana and what most of the doctors had here was the fact that cancer was a disease, or breast cancer, let me use that example, was for those from the ages of 50, 55. So we don't have that. As a nation, we don't have a cancer registry. So all these statistics that we're picking up, gone were the days that it was the WHO that was giving us the numbers. Now we're trying to do a bit of research, but it's so fragmented, it's not together. So one institution will do this and then come up with their figures, and another institution. Now I said that we only have two public institutions. That really doesn't talk a lot. And research is not something that we have moved into whatsoever. So we have most of these patients, and also we have the most aggressive cancers when it comes to breast cancer in Ghana and in Africa. Now that has been established in the Western world for us now. As to what it is, we don't know it. It's so unfortunate. Hopefully things will change. And again, that's why I talk about the status quo, because this has been with us for a very long time. And may I say about 2, 3 years down the line, when he had the Ebola case, and I don't know if you would remember,
I do very well.
and you do, great. So we had a team of researchers wanting to do a bit of research here in Ghana with some of the vaccines. Ghana, thank God, wasn't affected by the Ebola case. Now, it went to Parliament to get something that had to be passed. Now, these were people that actually sat, I would have thought that they were very learned and they may have been told about, told a bit about the need for research. They actually rubbished the whole thing. It was a huge thing here. Most people in Ghana didn't want it. The decision makers didn't help it in any form, because why should they try anything here? Who should be the how do we say it, the one to go through it, And I was so appalled because we live in a country where we get things handed over to us. So we don't take over our own healthcare decisions about us here. There are few that we do, but when it comes to healthcare, not at all. So when it comes to research, there isn't much being done in that area. Most would be the numbers that are reporting for breast and cancer. And now, just a few years down, I think I'll say about 2 years ago or so, there was research done into survivors of breast cancer. We didn't have that, and that was a small number as well. And again, if there's anything being done, it's very fragmented, so it's not seen as a national call to doing this. So it's rather unfortunate, I would say, to is it Sydney, is it, or the surgeon in Australia, that we don't have that as a priority, not at all.
Wow, wow, that's interesting.
I always call for that at any opportunity that I get, because we don't know why we're getting younger people suffering from breast cancer especially, and we don't know why their cancers are that aggressive. And therefore, we can't even look down and see what can we do. Are these drugs we're using for our patients even the best? And then we don't even have a way of measuring the outcomes. So we're just treating based on the drugs that are out there in the international community. Whether they work for us or not, there isn't much knowledge in there for us here in Ghana to work with.
Wow, wow. Well, so another question, though, and this is coming from the U.S., and this is coming from Lucille in Springfield, Ohio. And she said, well, I'm an oncology specialist, about 20 years of experience in practicing with the Center for Cancer and Blood Disorder. I am really touched by the work that you are doing, and it's unfortunate that research has not been done thoroughly in your country. I think this is one area that maybe after the show I'll pass my contact to Samuel and see if we can connect and see the possibility of doing a research from my school. I'm also a clinical professor in one of the schools here in Ohio. But my question to you is that, well, what I have seen is that a lot of Africans, especially African women in this part of the world, they find it difficult to go through examination, early determination, and diagnosing of the cancer. For instance, there was a lady from, I think, Nigeria, if I recall. This lady was diagnosed of cancer and she refused treatment. She rather preferred to go to church for her pastor to pray for her. Is that the same situation you guys have in your country? Because I'm kind of curious.
It is definitely, it is. So it's not any different than what you see out there. And you would actually think that it would be a bit better staying out there. So we have this consistently. And there are a whole lot of factors that actually doesn't make it easier for us here. I talked about culture. Culture is a big thing. And then also there's this aspect of spiritualism. I mean, if you come to Ghana, you think that 95% of all Ghanaians have some sort of spiritual background to whatever they do. So everybody looks at things in a spiritual way, even before they consider the physical. That is when things have gone way down, especially when it comes to healthcare. So yes, it is very common here. People come in very late after they've been to prayer camps, we call it here. They've been to spiritualists, they've been to herbalists, they've been to all sorts before they come in. So we have a huge task ahead of us. And also, when I say culture, there are things with regards to a lot of myths and misconceptions that has been passed over to us. So just 2 weeks ago, I had an opportunity to meet a lady. And she opened something up to me that actually got me thinking. I didn't think that was one of the reasons. So we're brought up in a way where when it comes to some issues, especially when it comes to the breast, and then when it comes to our other sexual organs, you are seen as not in a right way. If so, when I'm talking about breast cancer and teaching women how to do their own breast self exam, they normally would laugh or they go very shy. So I wonder, what is going on? Or when you're thinking of asking them to do pap smears for cervical cancer and stuff like that, they would say, okay, that's fine, we will do it at home or we'll do this and that. But they don't actually do because this is seen as very naughty, touching yourself as a woman. So I was like, oh, wow. So would this be the reason why people actually don't pick these things up early? And a whole lot of other things that come into play. So it's the same. When I was in England as well, I had that consistently, not just with Ghanaians, but those from other African countries as well who would come in very late. They want to pray first. They want to seek other alternatives first. And I always say to them, you don't do that when you have malaria. Why wouldn't you do that? Because malaria is a disease of the physical body. And same as cancer is, and same as hypertension is, and same as diabetes is. So we have a lot of work to do within that area to try and change people's mindset. To say this is not spiritual, because in the end, they don't stay at the spiritual places when things are worse. They come to the hospital, and there's nothing much we can do for them. And so people actually have this perception that cancer kills, and regardless of what you do, even when you go into hospital, and people don't make it. And actually, as soon as you get into hospital, that is when you die. So most people don't come. And they don't understand that it's because people come in very late, and they come in the advanced stages, and there's nothing much we can do when it comes to cancer.
Wow. Well, so why do you think uh, that is? What is the stigmatization view of cancer? You know, unlike I recall back many years ago when HIV/AIDS became the thing, and there were a lot of stigmatization. And I recall the Ghana AIDS Foundation, together with international bodies, with the UN AIDS, put a lot of funding into creating awareness and trying to reduce the stigmatization among people with HIV. Now, is that the same case of cancer? Because what you just said earlier on, that malaria is a sickness of the body, and so as all the other things you mentioned. But why is it that when somebody even get a simple headache or get a little fever, the person is in a rush to get to the hospital to get treatment and go through the medication process and even spend time to finish the course of the medication? But when it comes to things of cancer and all, is it because of how the public ridicule people who are diagnosed of the disease?
Yes, I would say there's two things that you mentioned that I would like to elaborate on a bit more. One you said was funding. So you talked about the National AIDS Commission and having the WHO putting a lot of support or funding in there. So one is funding, and then I would elaborate a bit more when it comes to the funding. And then the other bit would be the, the, the perceptions that we have had about cancer. So people actually think that cancer is contagious. People think that cancer is spiritual, and it might be because of somebody in your village that has given you that disease. And it's actually seen as a taboo as well. So when people get cancer, they don't want to see them in the midst of people. So to be or to hide away from that, you actually don't say anything to anybody. You hide yourself. And if you're, of course, actually going out into the public space, and especially going into hospital, because that's seen as a public space, then that's where people start noticing that this is what you have, and then you're stigmatized a lot more. When it comes to funding as well, we have the same issue with HIV. Now, you did say something. There was a lot of support to be able to change that perception. When it comes to cancer, we don't have that support. And I'm not saying we want that support from the WHO. And I am a firm believer of the fact that Ghanaians can actually find answers to their own problems and find money to solve their own problems. I don't know how long you have or how long ago since that you left Ghana somewhere, but we are
Long,
rich in this
long ago.
country.
Long ago.
Wow. We are endowed with a lot of things. But unfortunately, I don't know, we don't see that here in our country. We don't think that we ourselves can be empowered to do things for ourselves sometimes. And when it comes to things like health, even malaria, we get support from outside. I just sometimes don't understand it. So we ourselves haven't taken that mantle ourselves to change things because there's a lot to change. And I believe it can be changed because you said HIV/AIDS. Some years back, what you were stigmatized, nobody would come out. Now we have a lot more people going out into hospital and getting help. So people don't stigmatize it a lot more. So we need, as a country, as a nation, to be able to prioritize what is important. Gradually, things in the last 3-4 years, I would say, when it comes to cancer, the word is reaching to a lot more people now. It's being spoken to or spoken about a lot more without just covering your mouth when you say cancer, unlike before, because it wasn't a word that people, that C word, no, you couldn't say it. And more so saying you have it or somebody in your family has it. So I would say those are the two things. So our culture and then funding, trying to put this at the forefront and then trying to demystify all those misconceptions and the stigmatization.
Awesome, awesome, awesome. So, I know there's a question coming from Sierra Leone, but I want to hold on to that. So now let's talk a bit about changing the status quo in Ghana, particularly in the cancer care treatment. What are some practical suggestions that you think if government or those who make decisions, particularly in the healthcare system, will help change the status quo?
Yes, thank you for that. I'll say first and foremost would be to identify cancer as a national priority. It is actually a public health issue now, unlike some years back. So we're having a lot more people die from this disease. And a few years ago, there was research done to say that cancer has actually overtaken the deaths of malaria, HIV, and I think it was tuberculosis combined. But the point is, we don't have that statistics here in Ghana. We don't see that as an emergency because we haven't actually collated all those to say that, oh wow, this is actually killing more people than these three other health issues combined. So that would be the first thing, changing the status quo, is to recognize that this is a public health issue and something has to be done about it. And another aspect will be, with the government considering this, is the next step is, what then do we do? So for something as preventable as cervical cancer, we have most of the women dying. How can we change this? And as well, cancer care some years back wasn't even in the curriculum for nurses. But as you read my profile, I had the opportunity a few years back to be able to help the Ghana College of Nurses and Midwives to add that as a curriculum for the fellowship programs that we offer. But then that is when you have finished your nursing diploma or degree in Ghana before you have the opportunity to get in there. Another thing as well to change that status quo here is the way we actually care, the kind of treatment that we give here. So in Ghana, we have institutions here that are registered, private ones that are registered to see patients, but they are not regulated very well. So patients go in with an issue, which is cancer, but the doctors can't even diagnose it. So all of these have to be regulated very well. How patients are diagnosed from the beginning to the end. We don't have a cancer registry, so we can't even tell you what is actually happening on the ground. So that is another thing that we have to change. And so I'll possibly add the last one is we don't have a standard way of doing things when it comes to cancer. So you would have this public hospital doing this and another public hospital. We only have two. So they are not even uniform in what they do. So it makes it very, very fragmented. The care is very frustrating for these patients who have to go through this. So I said these are the ones that are very pertinent. But if we can start from that grassroots, we should be able to easily integrate the others into it and make a difference.
Wow, thank you so much for these details, and it's interesting because all the conversation that we are having, all this while, I just got a notification from the Honorable Minister uh, Kweku Ajimamenu in Ghana that is listening to the show. I think
Great.
he's the Minister of Health in Ghana that is listening to the show and is taking notes of all the things that you are mentioning. So hopefully, sir, since you were listening, hopefully the issue of cancer registry, at least for nothing at all, will be taken into perspective, and because this is so important for database management. Thank you so much. So let's go to Sierra Leone. And Sierra Leone, this is coming from Baba Jallo from Sierra Leone. And Baba Jallo said, "Oh, Gloria, you are so good. Will you be kind enough to come to my country, Sierra Leone, to start initiative there as well? Because just as you mentioned in Ghana, the situation is no different in Sierra Leone, if not worse. And the people aren't talking about it. And when people are diagnosed with breast cancer, they consider it to be, sorry, they consider it to be something of a fetish and juju and all that. So, how do we change that perception in the minds of our people that this is a health issue and has nothing to do with spiritualism?
We have a lot more work to do in the ground, I would say, than just you have to start from somewhere up there with the decision, but we need to get to the grassroots to be able to get to these people. We need to, once we do that as well, we have to do a lot more of advocacy and awareness. So awareness would eventually change things, because as people are aware, and as people hear and hear and hear and hear, and as people also get to know about those who have actually gone through the journey, who have survived it, who have fought, and they are survivors of cancer, when they're able to come out to say that this is me after cancer, then people would actually appreciate that, oh, people do live, or people survive this disease. But unfortunately, even the survivors do not want to be heard or known or seen, again, because of the stigma around it. Because people just point hands at you, oh, this is the lady that, this is the man, all those. So we have a lot of work to do in the grassroots. Similar to what they did with HIV, there was a whole lot. There was a campaign and that went around as a public health emergency, that we needed to change things, we needed to change that stigma. So that is what we have to do. But we need, again, the decision makers to make decisions up there that would affect whatever it is that we're doing in the grassroots. Because then we would end up doing things in isolation. And it takes a very, very, very long time to get everything together.
Awesome, awesome. There is a greetings to you from Jane Sapon, and she says she met you when you make I think you made a presentation at Quest Medical Imaging last year. So she's listening to you.
Oh, wow.
She wants you to know that she appreciates you. There is another greetings from Ernest and Beauty Quay. They said I should let you know that they love you so much and they've been following
Oh,
you all
lovely.
this while. So uh, if you think that nobody is listening to what you are doing around the world, pay attention again. People are watching you, Gloria, and you are making great impact in the lives of many people. So I'm also looking at the
Thank
time, and
you.
I know we have about close about 5 or 6 or so minutes to wrap up. There are a couple of questions
Wow.
that have come in already. An hour is past. Can you believe that? There are a couple of questions coming in. So um, let me go to Brussels. So let me go to Europe one more time. So in Brussels, and this is coming from Dinah, and Dinah said, "My name is Dinah. I'm a Ghanaian, but I live here in Belgium. My question to you is that in changing the status quo of cancer stigmatization in Africa, particularly in Ghana, we all have collective responsibilities to ensure that this is done and done thoroughly. My recommendation is that the Ministry of Health need to sit up immediately and consider the issue of cancer as a national threat. That is how the developed countries have treated the disease. They considered it as a public health issue and a national threat. And so funding and resources are put into place to tackle this. It is shameful that Ghana has no data or registry for cancer. But I hope I heard clearly that the Minister of Health was on the show listening. I know he will not listen that much, but the very few who are listening around him, please tell him it is so shameful that Ghana does not even have a registry for cancer and the data collection. Gloria, again, let me ask you this before I sign off. My question to you again is that what partnership role can your organization play with other institutions around the world so that all the things that you've identified can be resolved, particularly in the establishment of cancer register in Ghana, and also to carry out basic research to help resolve these problems. Thank you very much. That's a loaded
Thank you.
questions.
Thank you for
Yes,
this. Yeah. I can go ahead and answer this, right?
please, you can.
Okay. So I think the very salient things that I mentioned throughout this time that I've been talking.
I was actually talking about we collecting data and then analyzing that to determine what to do. So research is very important to us. We also have students from the international students from Lancaster University, UK, and that of Boston University that interns with us every summer. So for not always as part of their projects, and for the 2 years we've had them, we've done a lot of a bit of research or a bit of work in the community, just trying to get people's perceptions before we end up doing any project with them, basically. So research is very important to us, and we would love the opportunity to collaborate with any organization that actually shares our vision when it comes to research. And also, we would also want that support when it comes to knowledge transfer. So, with what we do, is one of the very few, if not the only institution that does patient support network when it comes to cancers. Most people would do just for breast cancer or prostate cancer, which is the most commonest ones. But we do all the cancers and we do it from beginning to the end with a support. So if we can partner or get another organization that does that already and it's actually has years of experience that we can tap into, then that would strengthen what we do here. So those are, I would say, the two important things that we need here to be able to strengthen what we do and then to be able to find out within our own world what exactly happens to us and what it is that we can do to change based on the information that we get from here. So I'd say those are the two most important things that we would love in helping to change the status quo.
Wow, thank you so much. Another question is coming from Yusuf in Qatar, and Yusuf's question to you is this: so, with all that you have said, what is the actual role of a woman in resolving or reducing breast cancer in their communities?
This is excellent, you see. When you say that when you're just narrowing it to breast cancer, one of the words that we used here, which is so important to us, is empowering people. So we just don't want to create the awareness or give you the information. We want to empower you to make a change in your life. So when you come to women, when it comes to women and breast cancer, when if we can empower a woman with this information, if it isn't even her that gets the breast cancer, he's able to disseminate that information to others to change the way things are done. So most of our work, again, when it comes to creating awareness, especially when we go to the rural areas, is we try and find the women that are seen as very important or very respected. So like queen mothers or in the market queens, they are the ones we empower most times to disseminate that, because we realize that we cannot get or we cannot actually meet everybody or impact everybody or actually create awareness to everybody. But when within the local areas, we can get those women that actually are very respected, then we empower them with knowledge, and then they would go on and change things within their community. So empowerment is very important, because at the beginning I said that if we're empowered, we make our own decisions, we take care of our own health instead of somebody actually telling you do this, do that, do that. Because that's what sometimes happens here. It's happened for many years where what the doctor says is what you do. You don't even know why. But when you empower an individual, especially the woman, they're able to change things in their community. So that is one of the things that we do a lot.
Wow, that is awesome, and you deserve all the support. And so, folks, be inspired. Listeners, I know you have always been supportive. I recall when we did the fundraiser for the kids in Uganda to buy them a medication because Gloria, it came to our attention that it only costs about $20 to buy HIV medication for kids for a whole month. And so we did a bit of fundraiser here, and we were able to raise a lot of
Right.
money that we sent to Uganda to support people. And so on the same vein, I thought that the work that you and the organization is doing, providing patient support care, worth to be supported. And so I want to ask all Be Inspired folks from around the world, if you know any institution, any research institute, any university, or organizations who are interested in partnering with institutions like PCCI to organize a research work, they are ever ready. And so please reach out to me, or you can as well look for Cancer Connect on social media, and you can reach out to Gloria directly and establish that relationship. It's so important because
Right.
the effort you put in today will help save a life of somebody in the near future. Thank you so much. I know our time is up. We've gone by 7 more minutes because we had a little technical issue. So I know there's one more question I have to take. So I will take that question. And when we come back, we will wrap it up and then we'll call it a day. This particular question is coming from Afghanistan, and it's coming from Mahmoud in Afghan. And Mahmoud say, thank you so much. I heard a little about culture. I know culture plays significant role when it comes to healthcare, particularly in the area of cancer treatment. Where I live here in Kabul, we have I'm a doctor here, and we have such situations here. A lot of people, based on cultural perspective, refuses treatment and creates a lot of problems for us as physicians. preventable diseases are unable to we are unable to prevent them because of this culture factor. I know Africa is has a very strong cultural orientation. Now, how does culture, if you have not already answered this, I tune in a bit late, but how does culture affect the management of patient care in Ghana, particularly with respect to cancer treatment?
Mm. So I think I mentioned that earlier on. Yes, it does play a huge role. So just a little example when it comes to breast cancer, we have most of the women also reporting late because in their community, as I said, this is seen as witchcraft or all sorts, and they won't actually get permission to come to hospital. There is a young girl who it's almost 2 years now when she found a lump. It's growing, but the family does not believe. She needs permission from the family to be able to seek treatment. So yes, culture actually does play a lot of role when it comes to healthcare and people seeking treatment in Ghana. There is also sometimes you have that of the male partners not allowing the women to go out there or actually allowing them to seek treatment for the breast because for them the breast is very important to them and therefore and that's what makes a woman that's the culture. So there's no way they would have the breast operated on or anything for that matter. So it does play a lot. But what I find as well is even though there's those strong links to culture, there is also a lot that we can do or we're doing to empower and people. And I started off by using the woman because the woman is the one who will take the kids to the hospital. The woman was the one who will look after the husband and when the husband is not well and also has to look after herself. So if she is empowered, then gradually things will change. So what we're doing is within the rural areas, we're starting from schools now, where we actually educate these young girls and young boys, but mostly young girls, about their health, but most especially what pertains to cancer. So breast cancer, we're asking that they should start screening from the age of 20. Cervical cancer is even earlier on because most of these children are actually having sex a lot more earlier. So they are prone to these cancers a lot more than you would think. So we're doing that. And what you do is when you empower them with the information, and empowerment is very important because empowering is not just telling them that this is what it is, but actually getting them to own and actually accept whatever knowledge it is. And so it's not just information we're giving them, it's knowledge transfer. And when we do that, we see that things change. So we're hoping that if we can do this a lot more, not just us, we love to partner with a lot of people and we'll see what we can do within that vein. Because I believe gradually things will start changing, gradually. The culture will be there, but there'll be that aspect that people then understand why things have to be done in a certain way and what it is that can be done to save people instead of all those old culture things that we've been holding on to for a very long time.
Wow. Thank you so much, Gloria, for spending your evening with us. It's a great investment of your time, I must say, because you've imparted, you've educated well over 19,500 people in one setting within an hour period about the things going on in Ghana, and we are very grateful for this opportunity to have you. And so, before we wrap it up, I will again come back to you, and if you want to give us your wrap up session, and then we'll call it a day.
Okay. So thank you so much, you all, for listening, tuning in to listen, and for having me. I would say that cancer care, and that would be what ends my profile. It's not just a privilege to a few people. It is a fundamental human right for people to actually have the opportunity to be cared for properly when it comes to cancer, to be diagnosed properly when it comes to cancer. But we can't do this alone. We need the efforts of everybody, not just in Ghana, but around the globe to change things, because now the world is not just within the setting that you find yourself. We're in a world where you find people from different parts of the world coming together as one. So it's not just a Ghanaian thing, it's everybody. So anything or anybody willing to support in this effort to go further with what we're doing, and we would love that, because I believe that once we do that as a community, as together, as partners, we just don't effect change just here in Ghana. We end up moving to all the other countries in Africa and then move to the world, wherever it is that they need that support. So I would say everybody has the right to have proper cancer care, and everybody has the right to also enjoy that same kind of care that others would get elsewhere, especially here in Ghana. Thank you.
Thank you so much. Thank you, folks from around the world, for supporting our show today. We are very grateful to Gloria and to Cancer Connect and the PCCI for allowing her to spend some time with our audience. We are very grateful. And, folks, I wish you all the best. Enjoy the rest of your weekends wherever you are. And next week, we will be talking to NM. She's releasing a new single track for a gospel music track called Unarmed, and then I'm sure you will get the notification, and then we will connect next week. God bless all of you. Enjoy the rest of your evenings with your family. Enjoy a piece of music, and our next show comes up in the next 1 hour. Thank you once again, and thank you everyone for supporting. God bless you all.
Welcome to Weekend Night Live, hosted by Samuel Jacobs Abbey, where we play music, talk shows, and interviews on Be Inspired Podcast Network. Stay tuned and keep your dial on www.beinspiredpodcast.com. Don't forget to stay connected, be inspired, be unique, and be different.